4 in 10 GPs quit the NHS within 5 years of finishing their training. If you're worried about the shortage of doctors, difficulty of getting a GP appointment, well, it's all really obvious, isn't it? We haven't got enough money going in the NHS. The Prime Minister's going to promise, we're told, an extra £4 billion, an extra 3.3% every year increase in funding. Hopefully that will start stemming this flow of people out of the NHS. But with so few people training here in the UK to be doctors, and that's being boosted now by 25%, the Health Secretary Jeremy Hunt has said, but that's going to take 7 to 10 years to come through to being experienced practitioners. We're still importing people from abroad to do the job. But one of the other problems, of course, is the fact that once we do train GPs and once we put them in those jobs, they don't stay. 4 in 10 quitting within 5 years of finishing their training. Well, let's try and find out why that is. Let's talk to two guests, North London GP Dr. Ellie Cannon and Jamie Kaffash, who's the news editor at Pulse magazine, the magazine for doctors, joins us now. Good morning to you both.
Good morning.
Good morning.
Now, if I could come to you first, Dr. Ellie Cannon, you are a GP. You're not quitting, I hope. But why are so many GPs quitting after just 5 years? And what can we do to stop them leaving?
Well, I think it's very hard. I mean, I'm coming up to my 10th anniversary being in the same GP practice. So I think for a certain generation of doctors, this is sort of quite surprising. But something that Ian Cummings said, he's the head of NHS staff, he said that, doctors going into general practice now don't want the sort of hours that GPs worked in the last few decades. People want flexibility. They've been shown that they sort of don't necessarily have to work night shifts when they're training as junior doctors. So there's been quite a shift, and there's quite a shift in expectation. And I'm loath to sort of blame this on millennial attitudes, but there is certainly a change in expectation.
They're snowflakes. They're snowflakes.
Is
it? I always think part of the issue is, if you're a straight A student, you're doing really well. You're getting into good universities. These are the the brightest and the best. And then it's like, actually, you've got to slum it with some pretty rotten hours in some pretty rotten old buildings, and thinking, do you know what? Is it worth it? But is there also an issue, Ellie, that actually, I know most doctors don't earn huge amounts of money. And my goodness me, I want our doctors to be earning more than silly city bankers who put us all in trouble. But is there also an issue where pay rates did go up? So if you have actually got a job as a GP, you're not locuming, you can actually make a perfectly nice living working 3 or 4 days a week rather than 5 days a week. So they're working part-time. So even though we've got the same number of doctors working fewer hours, fewer patients are being seen.
Well, I don't think it's quite as simple as that, just to do with money. I think a lot of GPs also want to do other things. So just within my practice, my colleagues...
Well, you're on the radio.
Well, exactly. But my colleagues do teaching, my colleagues do management, and my colleagues work for the CCG. People like the portfolio within general practice, and that's very important because you can burn out very quickly in general practice, working 5 days a week with the sort of morbidity and mortality that we see.
My mum worked 5 days a week for decades as a GP. She didn't burn out. I mean, she was in Bath, where virtually all of her patients, I worked in a surgery bit, were elderly. What's so uniquely different now?
I think it's very different now. I think it's very different now with the burden of social problems and mental health and what we have to deal with in terms of bureaucracy. I think it's incredibly difficult. The targets. Your mum working as a GP would very much have been a not sole operator, but really in charge of what she was doing. GPs now have such a lot pressing down on them from above, from CCG level upwards, and then so much pressure from patients as well, and expectation. I do think there is a huge difference now in the pressure on GPs.
That's fascinating to hear, Dr. Ellie Cannon. We're going to let you go so you can go off and do your GPing. Dr. Ellie Cannon is a North London GP, of course, regular on Talk Radio. Let's talk to Jamie Kaffash now, as a news editor at Pulse magazine. Jamie, one of the things that's most worrying about these stats about 4 in 10 GPs quitting is that it costs taxpayers around £500,000 to train them over 10 years to get to that point. And of course, those are wonderful skills, and those are skills that are lost to the NHS.
Well, indeed. I mean, not having seen these statistics myself, I'm not entirely sure about the veracity of them. But
wait a minute. These statistics are from Ian Cummings, head of the NHS's staffing body. I'm going to guess he does know his numbers.
Yeah, no, I'm sure he does. Sorry, I wasn't questioning the authenticity of it, but not having actually looked at them myself. There is a problem with GPs leaving the NHS, but something that we've noticed, we actually did a special last year where we spoke to trainees. And what they told us is that, yes, they are looking to try other things, immediately after finishing their training, but they want to come back to the NHS. I think that's quite an important point, that these aren't people that completely lost the NHS forever, but it is something that they do want to try different things, and it might be a bit of a generational thing there. You know, the previous generations may not have wanted to go to Australia and New Zealand. I was speaking to a leading GP this week, actually, who said that actually in their time when they were training, the idea of going to Australia and New Zealand was simply was unheard of. But nowadays, you know, it's not just GPs. It's the whole far more people want to go and try different countries, try different ways of living, and then come back and then start their career in the NHS then. So it is, although they are worrying, I do think that it's a bit dangerous to say that they're lost to the NHS forever.
Was a lot of them, and we were talking actually to one of my guests this morning, she's actually got a number of friends who trained as doctors and who've decided just to give up working in the NHS or as GPs or and those routes, and they're still available to the public. They're working via apps. They're doing work as locums. They can get paid a much higher rate. I mean, this is the basic problem, isn't it? Because they're still being paid a lot of the time by the NHS. It's just being paid on silly, stupid contract rates or freelance rates, and really this is about sort of management of budgets by the NHS, an awful lot of this.
I mean, it's interesting that you raise the point of apps. Yes, especially in the last couple of years, there's been a huge number of apps that allow you to speak to a GP within 25 minutes or whatever. And this is a bit of a problem because, as you quite rightly point out, these are GPs who would be working in NHS otherwise. So the idea that this is sort of a solution to longer waiting times, to us, that seems like quite a dangerous idea, because these GPs aren't being just magicked up. They are coming from the NHS. They are the ones that have been trained by NHS. As a result, they're not the ones that are seeing you in their own practice. So if you're not signed up to one of these apps, if you want to see a GP face to face, then there's fewer of them around. So yeah, I think you're right to point that out.
Well, I mean, in terms of what's going to be solved in the coming years, we know that they've really stopped some of these ridiculous limits on the number of doctors and nurses who can train in this country. We've got a wealth of talent, people who want to train as doctors and nurses who've not been allowed to actually get on those courses. They're severely limited. So we're going to see 25,000 more doctors trained. Again, that's going to take 7 to 10 years to come through to a reasonable level. Releasing the tight controls on the number of nurses as well. And they are going to, Sajid Javid, the Home Secretary, has announced they're going to be allowing more doctors and nurses to come in from outside the EU. They're no longer going to be affected by these tier 2 visas. Is that going to help? If the NHS can actually recruit people from wherever in the coming years, will that actually ease the burden on the people who are still in situ and perhaps prevent some of them from walking away from their jobs?
Well, that is a big if, because I think that NHS have already put a target of getting at least 2,000 GPs from overseas, be it the EU or elsewhere. And unfortunately, this hasn't been working so far. This was a target that was set sort of last year, and so far we've only had 85 GPs actually coming into work in the UK. So it's not as easy as just saying we'll go to these other countries and we'll pick up some GPs from there, because we need to convince them that UK general practice is where they should be. And there are a lot of horror stories about UK general practice at the moment. We're hearing that GPs are working average 11-hour days. Workload is intense. There's more GPs going off sick with burnout than ever before. So it will be hard to convince GPs to come from overseas. If we can do it, then obviously that would relieve the burden, and hopefully it'll break this vicious circle that means that the GPs coming in having to do more work and as a result, more GPs having to leave.
Yeah, but I do wonder again, given that we know that more GPs are working part-time than ever before, and it's not just women with young children, mums with young children, it's dads with young children, but it's also GPs across the board. Lots of them are routinely now working part-time. I do wonder about this, because I think and it's something I've spoken to my mum about, who was an NHS GP for decades, is that actually, she worked a 5-day week with children, and her view was that actually, it's very difficult to actually keep on top of that job if you're not working full time, if you're not there available to patients, and especially seeing the same patients who want to see the same GP because they've got a lot of chronic problems and they need somebody who understands their situation. That actually, maybe if you want to work part time, maybe medicine isn't the career for you.
Well, I think that the idea of continuity of care, I think we are losing that. It's not likely that you're going to be seeing the same GP every time you go in. But I don't think that's due to GPs working part-time. I think that's just due to the fact that there's so much more demand on GPs' time than there used to be.
Yeah.
We've got a far older population. We've got a population with far more multi-morbidity, meaning they don't come in with a single problem, a condition. They've got far more conditions. So this is putting more demand on GPs. So it seems that, sadly, that continuity care is something we're losing. But I wouldn't say that's due to the fact that GPs are working part-time. Even if we had GPs, even we have every GP in the UK working full-time, it would still be difficult to provide that continuity of care.